To treat a disease, a drug molecule must first dissolve in the body's fluids and then pass through cellular barriers. But modern pharmacology is increasingly designing synthetic molecules that biological systems actively reject on both fronts. Take cyclosporine. It is highly insoluble in water, meaning it won't break down in the stomach. And it is highly impermeable to biological membranes, meaning even if it did dissolve, the intestinal wall rejects it entirely. For decades, pharmaceutical engineers relied on empirical, trial-and-error mixing to create tablets. Throwing standard binders and fillers at a molecule like this results in a pill that passes straight through the digestive tract completely unabsorbed. This grid is the biopharmaceutical classification system. It categorizes drugs based strictly on their solubility and permeability, ranging from Class I, which easily dissolves and absorbs, all the way down to Class IV. This bottom right quadrant isolates molecules with both low solubility and low permeability. These Class IV drugs represent the absolute ceiling of pharmaceutical difficulty. Rescuing these complex therapeutic agents requires abandoning legacy compounding. We have to adopt a strict predictive scientific methodology to physically force absorption. That predictive methodology is known as quality by design, or QBD. It is the mandatory engineering framework for modern drug formulation. Under QBD, engineers do not mix a batch and test it to see if it works. Mathematical and structural quality must be built in from the ground up, rather than tested in at the end of the manufacturing line. The process follows a strict sequence. It begins by defining the quality target product profile, mapping exactly how the drug must perform clinically, and cascades down into specific critical quality attributes, material attributes, and process parameters. The final stages run these parameters through failure mode effect analysis and design of experiments. These statistical matrices calculate exact mixing speeds, compression forces, and material ratios to predict clinical performance. This statistical validation maps raw material attributes directly to clinical results, allowing engineers to identify and mitigate manufacturing risks before the first physical batch is ever mixed. With the QBD blueprint established, engineers can systematically dismantle the physical barriers of a Class IV drug, beginning with its inability to dissolve in water. Highly hydrophobic molecules naturally arrange themselves into rigid, tightly packed crystalline structures. This configuration creates a massive energy barrier that prevents surrounding water molecules from pulling the drug apart. To bypass this barrier, formulators use a technique called solid dispersion. Hydrophilic polymer carriers, like PEG, are introduced at the molecular level. They invade the tight crystalline grid of the drug, breaking intermolecular bonds and scattering the payload into a chaotic arrangement. This forces the drug out of its natural crystalline state and into an amorphous physical state, neutralizing the massive lattice energy barrier completely. By destroying and reorganizing the molecule's solid-state architecture, formulation engineers effectively bypass the drug's natural thermodynamic limits to force solubility. Once the drug can dissolve, it still faces the second barrier. It cannot penetrate the intestinal wall. To solve this, the payload is encapsulated inside lipid-based nanocarriers. Early designs relied heavily on pure solid lipid nanoparticles, or SLNs, to shield the drug. But relying on pure solid lipids introduces a severe structural liability. In storage, pure solid lipids crystallize into a perfect lattice. This dense formation reduces core space, physically squeezing the drug payload out, causing leaks. The modern evolution is the nanostructured lipid carrier, or NLC. It utilizes a highly specific blend of liquid and solid lipids. Mixing these different lipid types forces the matrix to form an irregular, imperfect structure. This prevents the lipids from ever forming a tight crystalline lattice, ensuring the internal payload remains securely trapped. In nanostructural engineering, a perfectly organized matrix is a fatal flaw. Deliberate structural imperfections are required to hold a pharmaceutical payload. Classical pharmacy viewed the secondary ingredients, the excipients, as biologically inactive fillers used only to add bulk. Modern formulation requires a completely different approach. Consider vesicular carriers like liposomes. Because they are built from natural phospholipids, their structure directly mirrors human cell membranes, giving them excellent basic biocompatibility. However, raw liposomes face rapid clearance by macrophages. To survive, they need a slick surface, so macrophages repeatedly slip off without destroying the carrier. To prevent this clearance, engineers employ a functional excipient strategy known as pegylation. By chemically attaching chains of polyethylene glycol to the phospholipid heads, they construct a dense hydrophilic surface layer around the entire liposome. Plasma proteins and macrophages simply cannot grip this slick outer shield. These functionalized PEG chains act as biological modulators, intentionally manipulating metabolic pathways and dictating exactly where the vehicle travels in the systemic circulation. The final stage of formulation methodology dictates exactly how the payload deploys once the carrier reaches its destination. There are two main strategies for extending drug delivery: sustained release and controlled release. Conflating the two is a critical clinical trap. This graph tracks time versus drug concentration. The wavy line shows sustained release. Its rate fluctuates based on physiological variables like local pH. Conversely, the flat line maps a controlled release profile. It maintains a predictable, zero-order release rate, ignoring external biological conditions entirely. These systems do not react to the patient's digestive environment. They are governed entirely by their own internal architectural design. True therapeutic control is only achieved when the formulation's release profile is entirely severed from the unpredictability of local organ physiology. We can now return to that highly restrictive Class IV cyclosporine molecule and process it through this methodology. Engineers define the target release profile, establish the exact particle size required to bypass the crystal lattice, and map the precise mixing speeds as process parameters within the QBD blueprint. The ultimate textbook solution derived from this data is the self-microemulsifying drug delivery system, or SMEDDS. This specific lipid-based configuration encapsulates the highly hydrophobic payload in a protective core, masking it from aqueous environments while providing the exact lipid profile needed to slip through the intestinal wall. It mathematically satisfies both the solubility and permeability requirements at the exact same time. Through rigorous statistical and structural frameworks, engineers force an entirely insoluble and impermeable drug to become highly bioavailable. These advanced techniques provide the precision required to ensure toxic payloads, like chemotherapy agents, accumulate strictly at disease sites without damaging healthy tissue. By creating these specialized delivery vehicles, manufacturers can renew patent protection for legacy molecules, extending a drug's commercial lifespan through innovative physical engineering. In modern formulation methodology, clinical efficacy and safety are never left to chance. They are not discovered at the end of the manufacturing line. They are systematically, physically, and mathematically engineered into the blueprint from the very first principle.